Good morning, everyone. Welcome to the second week of our webinar series on public policy. This morning, we are happy to welcome Patricia Neatman, Kim Batchy-McKenzie, Stacy Farrell, and Alyssa Cosgrove from the Bureau of Children's Coordinated Health Policy and Supports at the Michigan Department of Health and Human Services. Patricia Neatman is the Bureau Director for the Children's Bureau with 23 years of service and leadership roles in child welfare. She will provide an overview of the Bureau's initiatives and highlighting the Michigan's tool and the development of the data dashboard by the Bureau. Kim Batchy-McKenzie is the Division Director of Program and Grant Development and Quality Monitoring at the Bureau. She focuses on services and supports for children and families. Stacy Farrell is the section manager for the Clinical Support and Service Navigation section at the Bureau, ensuring children receive necessary health care and policy support. And lastly, Alyssa Cosgrove is the State Assistant Administrator at the Bureau. Thank you all for being here, and I'm going to turn it over to, I believe, Patricia.
Thank you, Sherry, and good morning, folks. We are happy to be here with you today. Thank you for having us. I am Patty Neatman. I'm the Director in the Bureau of Children's Coordinated Health Policy and Supports. And we have sort of a team planned here for a presentation of some information and updates about what's happening in our Bureau. So we're going to talk a little bit about the background and the Bureau, how the Bureau came to be, our purpose, some of our primary functions and priorities, our project areas and areas of focus, and then leave some time definitely to answer questions. So this is a graphic that we often use when we're talking about the work that we do within the Bureau of Children's Coordinated Health Policy and Supports. And just as a by the way, we have long titles, and folks most often refer to us as either the Children's Bureau or by our acronym, which is BCHPS. But this is a overview that we like to use to sort of demonstrate visually what the current system overview can look like for children, youth, and families in Michigan who may be interacting with several different systems that serve children, youth, and families, including the Michigan Department of Health and Human Services, our state psychiatric hospitals, school-based services, our CMH community mental health service programs, our PIHPs, or our prepaid inpatient health plans, our Medicaid health plans, our 12 federally recognized tribes in Michigan, and different various providers who may provide behavioral health assessments and treatment services for children who are involved in the child welfare system. So it can be quite overwhelming. Many families are involved with multiple systems simultaneously, and we just wanted to really demonstrate and illustrate what that can look like for families. All righty. So the Bureau of Children's Coordinated Health Policy and Supports was created in March of 2022, and that was done out of a recognition that increased resources that could be provided, that were needed, that could be provided within a larger work area than what had existed within MDHHS. And the purpose was really for this work to build upon and consolidate work done to support behavioral health for children, youth, and families that was done in different pieces within the Bureau into within the department into a single bureau, and restructure how we deliver publicly funded specialty behavioral health services to better service children, youth, and family. Our Bureau operates off principles that involve recognizing that services for children, youth, and families need to be designed specifically to meet their needs. Emphasizing the critical importance of including both family voice and youth voice in addressing health needs of children and youth. We've also established a clinical support team to serve as a statewide resource and provide support to our community mental health programs, our PIHPs, other behavioral health providers, as well as our other systems providers, including the child welfare system, our juvenile justice system, and also to children, youth, and their families. And we'll talk more about that in a bit. And lastly, just pointing out that our Bureau works very closely with other administrations within the department to address prevention and response, as well as many of our external partners, system partners, and families. Alrighty, so these are our three divisions that exist within the Bureau. Just going to briefly go over these with you, and each of the division directors will give you some more detailed information coming up. So the Office of the Advocate for Children, Youth, and Families is led by Stacy Farrell. She's the division director there, and their purpose is to implement the clinical support and service navigation team that provides some clinical support and guidance in the delivery of specialty behavioral health services for children, youth, and families. The intellectual and developmental disabilities and autism section also exists within Stacy's division, and that is where we support programming, partnerships, trainings related to IDD as well as autism. The Division of Program and Grant Development and Quality Monitoring, led by Kim McKenzie, is responsible for the development and management of specialized programs, our early childhood initiatives, our evidence-based practices for children's behavioral health. They manage all of our grant funding programs and initiatives, as well as maintaining our data and quality section for increased transparency related to data related for behavioral health services for children, youth, and families. Also building sustainable relationships with other state agencies that deliver services and oversee child serving systems, and working toward the implementation of a family-driven and youth-guided approach in all aspects of what we do in our work, and partnering with children, youth, and families and the design and implementation of the work that we do within the Bureau on programs and services. And then third is our Division of Access Standards, Service Array, and Policy. And there is where we house our development and management of Medicaid funded home and community-based services for children, youth, and families. Oversight of our waiver programs are there, as well as our statewide wraparound coordination. We, in this division, oversee the development of a standardized assessment process, which is the Michicans, which we'll talk about in a moment. And also out of this division as well, provide some coordination around education and training for programs related to children's behavioral health. This is what our high-level organizational chart looks like right now. You can see that Allie Cosgrove is usually my state assistant administrator. She right now is wearing two hats and is working also as the interim division director in Access Standards, Service Array, and Policy, which is normally led by Phil Kordonowitz over here on my right. Phil's currently on parental leave, so Allie is working in his place at this time. We have our three divisions here with these sections listed underneath them. So you can see the three division directors, as well as all of our managers, our section managers within each of our sections here. And I am going to pass this off now to Stacy Farrell, who's going to talk about the Office of the Advocate for Children, Youth, and Families. Stacy?
Yes. Oh, sorry. Good morning. Thank you. I'm Stacy. I'm the Division Director in the Office of the Advocate for Children, Youth, and Families. As Patty kind of shared, we have two sections in our division, and the individuals with developmental disabilities and autism spectrum disorder sections, and then the clinical support and service navigation section. Overall, the goal in the approach to support programming and partnership related to individuals and with intellectual developmental disabilities and autism spectrum services is done through, the work through providing support for the Autism Council. They offer statewide trainings with regard to ASD, the diagnosis, the evaluations, and again, a lot of work done around updating Medicaid policy to improve service delivery and access to and address systemic barriers to access to services and supports. Again, and some of that work done right now, they're currently working on a document, a guidance document for the provision of behavioral analysis in public schools, and that's in draft form. So there's a lot of work around that, knowing that's a need. And then they partner with other agencies to develop, and as I mentioned, guidance and support on kind of addressing some of those systemic needs. With regard to the clinical support and service navigation section, within that section, the goal is to partner with children, youth, and families, and behavioral health service providers, child welfare agencies, and other supports. And in that section, we pull teams together to really provide treatment recommendations, technical assistance, and ensure access to needed services, with a collaborative approach and really with the goal of strategic addressing those complex behavioral health challenges that so many of our families that we see in children, youth, and families that endure daily. So that's truly what the goal of this team is. We receive, we have an email box that we can share. We receive requests, and they can come from service providers, CMHs, PHPs, child welfare. We receive from hospitals directly, whether it be youth that are in the ED, and social workers will reach out, if we're working on discharge planning, or if there's barriers for that youth and that family accessing a certain level of care. We receive them from advocacy groups, families directly, and we respond accordingly. We look at the urgency. We receive non-urgent and urgent referrals. An example of an urgent referral would be a youth that's currently in the ED, meeting or not meeting inpatient level of care. We'll pull the team together to kind of address what are some of those barriers to help support maybe access to that level of care. Or, discharge and the discharge back to the community, and making sure that we have the appropriate services and supports in place. An example of maybe a non-urgent, although that we consider them all pressing and urgent, would be a youth that maybe is involved in child welfare, and there's, maybe placement instability with their current placement, or if they're in a congregate care setting and there's a discussion about transitioning to another congregate care setting. We'll pull that team together. I think, and again, as a team, we really looking at what identify what the barriers are, what are those challenges, and pull the team together to address those. And again, in a very collaborative, supportive approach with, again, we keep the needs of the family, and again, I'll use this term, family-driven, youth-guided approach, where, the family and that youth is at the center of all that we do, and making sure that their voice is heard in that process, so we can really address what their needs are and, walk that with them together. I think we can go, on the next slide, we just provide a little bit of a data. It just kind of gives you an overview of what our team currently sees on a month-to-month basis. As you can see, we average anywhere from roughly 40 to 50 new referrals a month. And And again, we have a commitment to respond to those. If they're an urgent referral, we respond to those referrals within 24 hours, one business day, or if they're non-urgent, we will make sure that we have a response and, moving forward with that team within 48 hours. As you can see, like most of our requests are urgent referrals, and we see many youth currently in the ED, or, we're supporting discharge planning, or we're concerned about placement disruption. As of, we started collecting this data, I think, and Patty, correct me if I'm wrong, of June of 2022. And we've received over 800 referrals. And I see the question here, who makes the referrals to us? And that's a great question. Anyone can make a referral to us. And one thing that I'm neglecting in this slide is, in my presentation part, is we have an email box that is manned by our clinical social worker, and we look at that daily. So really, truly, anyone can make a concern. A referral will pull teams together based on that referral. We certainly aren't in a position to say what would be, an appropriate referral to us. If we look at it and maybe we could use support in a different, team section, we will kind of make sure that connection's made. If not, we'll pull a team together. So I will, make sure that we include some of that information, maybe in follow-up, if that's okay. If not, if there's not any other current questions, maybe I will turn this over to Kim.
Good morning, everyone. My name's Kim McKenzie, and I just wanted to highlight that the clinical email box is now in the chat if you're interested in seeking that. So I am the division director of a division that oversees 3 sections. One is data monitoring and quality. The second is evidence-based practices and grant development, and I would also add early childhood in that. And then the third is family and community partnerships. So I wanted to kind of highlight a little bit about each section. And I see we do still have some questions coming in about the clinical review data. And so we will definitely get to those. And I can either Stacy can pop back on when I'm done presenting, or we can make sure we cover those at the end. So I just want to make sure that folks know, even though we've moved on, that we are still welcoming questions and we'll respond to those. So the data and quality improvement section is brand new for our children's area. So as Patty mentioned, our Children's Bureau is fairly new. It is only a couple years old. It really, though, is and it has grown a lot of the work that has been done for many years. But the data and quality section for children, youth, and families is brand new. We always kind of work together with the adult behavioral health data and quality area. And so we were really not utilizing a lot of the data that we were receiving at the state level. And we were not able to really access that data always in real time. We'd make a request and then the data would get gathered. But to be able to really have a much more hands-on approach and focus on children's behavioral health data, this new section was formed. So it's small, but mighty, I say. And so they are doing work across the entire Bureau. So some of the work has to do with the Michigans. Some of the work has to do with other data requests from other sections. A good chunk of the activities are working with a vendor to help us to build a dashboard that we can use on a daily basis internally. And then we will also have a dashboard, a data dashboard that will be publicly facing. So that publicly facing dashboard is still in the works. We're still in the midst of developing it. I do want to say though that we are doing some user acceptance testing of the dashboard, and what that means is that we've talked to 6 parents or caregivers with lived experience and had them kind of walk through with someone else the dashboard to see what questions they had, what didn't make sense in terms of navigation or content. And so we're actually have summarized the results of that feedback and are making changes. And then we're going to do another round of user acceptance testing. Again, we want to continue to make improvements, but we really want to involve the input and voices of individuals with lived experience throughout the development process. Quality improvement is really important to the Children's Bureau as well. There is a quality improvement initiative that's happening at the department, but also that's happening on sort of that adult behavioral health side as well. So again, we bridge back and forth all the time, even though we are in separate bureaus. We partner very, very closely because a lot of the work that we do is really dependent on Medicaid. It's dependent on the rate setting process. It's really dependent on contracts and other aspects that are found in our the Adult Behavioral Health Bureau. So the second section is evidence-based practice and grant development. And that is led by Mary Ludke. She's been around the department a long time. We oversee upwards of 150 different projects. And we have, I believe, 10 to 12 different fund sources that we're kind of managing. Some of those are federal, some of those are state. We run several federal grants that are out of this section, and staffing that occurs for those federal grants out of this section. Medicaid match projects are run out of this section. And then the big thing is children's evidence-based practices. So we support a lot of children's evidence-based practices for the public mental health system with mental health block grant. Now there's other evidence-based practices that occur around the state, but some of those listed on the screen are ones that we support with mental health block grant dollars and other dollars. So early childhood court, for example, some of you may know about that as baby court. That is a different federal grant that we have for the next, it's a 5-year grant, but we're a second year in. So that's just an example of a lot of the different things that are happening in that area. And as I mentioned, a lot of early childhood work, partnership with our MyLeap, which is affiliated with the Michigan Department of Education around various projects. So there's a lot happening in that area. And then the final section is managed by Justin Tate. And that's the Family and Community Partnership. And so we recognize that children and families exist in the context of many child serving systems. So there are actually dedicated staff that help to pay attention to those unique partnerships that we have with, for example, child welfare or schools or juvenile justice, just to name a few. So this section is also one that focuses on ensuring that we are training and educating and utilizing our family-driven youth-guided policy. And then the peer-delivered services on the children's side are overseen in this section as well. There's a grant as well that is overseen in this section, and that's the Project Aware grant. And we are in, I believe, our final year of that particular federal grant. And so since I mentioned the managers from each section, I wanted to go back to the data monitoring and quality improvement section and mention that the manager in that area is Erin Mobley. And I didn't see any questions coming in. So if you wouldn't mind advancing the screen, I'm happy to take questions. This slide just goes a little bit deeper into our, the data dashboard that I was mentioning. So why are we doing a data dashboard, you might wonder? And the purpose is really, we want to increase transparency. We want to be able to really pay attention to the availability and utilization of services. We want to pay attention to access to services, timely access to services. So that data will help to support our specialty behavioral health service expansion, as well as continuous quality improvement efforts. So I mentioned that the dashboard will compile and analyze specialty behavioral health data, and that we hope that the publicly facing dashboard is going to be in a user-friendly format. We're still working on that, and that it will be able to clearly communicate kind of some data that's happening that hasn't always been readily available or easy to find. I would say next slide, please. One thing I did want to mention about the dashboard is, so sort of there's three phases. One is that internal dashboard that we at the department can really use when we're making decisions about programs and policies in real time, in meetings. We'll be able to look at real-time data. The second dashboard is that publicly facing dashboard. And then we have this vision of a third phase, which would be a dashboard that might interface with other data from those child serving systems. So that is not fully formulated yet. That's sort of a ways out, but that's a vision that we have, is something we would like to do. This last slide is, again, I mentioned we're really committed to and want to incorporate the voices of individuals with lived experience. One way we have strategized to do that is to send this information out. And if you want this particular slide in a different format, if you want to share it with your network, we would ask that you share with parents, caregivers, youth, young adults with lived experience. Once we receive one of these brief forms, and what people are saying is, yes, I might be interested in being a part of something. I don't know what that something is yet, but I'm happy to talk to somebody and learn what might be opportunities, whether it would be a survey or a focus group or art, that type of thing. We might be able to, we just want to have a list of people that are sort of interested, so that when we need partnership and when we need input, individuals are available. So if you ask folks to fill out the form and they do, someone from that data quality section would be reaching out to schedule a face-to-face meeting to just get to know that person and learn a little bit more about what their areas of interest are. And there might not be a need today, but there might be a need in 6 months or in a year. And so just getting permission to reach back out when we have that need, that's kind of what we're trying to compile. And I believe I am turning this over to Ali Cosgrove, unless there's any questions for me. I don't see any, but I will still be here and available if other questions come up. Thank you.
Thank you, Kim. Appreciate it. Good morning, everyone. My name is Ali Cosgrove. As Patty said, I typically work as the state assistant administrator within our bureau. I am currently serving as the interim director for the Access Standards, Service Array, and Policy Division within our bureau. Our normal director, Phil Kordunowitz, is out enjoying snuggling a new baby for a little while. So I have stepped in to take over in that area, but normally Phil Kordunowitz is the lead there. So Access Standards, Service Array, and Policy As you can see, we have two sections in this division. The first one is our home and community-based services policy and implementation section. And so this section is where all of our children's waiver programs lie. So we have the children's waiver program, serious emotional disturbance waiver, also policy development for the home and community-based services programs. This section is in charge of administering and providing technical assistance on the mobile crisis service expansion, which I can talk a little bit more about if folks are interested in hearing about that. Working with other MDHHS divisions to support behavioral health policy for children and families. And this section is also in charge of certifying providers for provision of those home and community-based services, supporting policy and program oversight of our Michigan Intensive Child and Adolescent Services, also known as our MICUS array. And I'm going to dive into a little bit more in a minute here on what those services are. And then also oversight of our statewide wraparound programming. The second section in this division is access standards, workforce development, and education. And so this section is really focused on implementation of the Michicans, and I'm going to dive further into the Michicans here in just a minute so you can learn a little bit more about that if you're not familiar with it. But essentially the Michicans is our standardized statewide behavioral health screening tool. And then we also have a comprehensive tool as well. Another focus of this section is workforce initiatives. So really working to expand our behavioral health workforce. As many of you are likely aware, there's quite a staffing crisis concern right now. And so really working to build out some programming via internship stipends, student loan repayments, and some other things that we're working on to help build that workforce up. We also are working on expansion of providers through a capacity building center. So that will serve likely as that will serve as a hub, kind of a training hub for individuals to receive training, for providers specifically to receive training. We are currently working on awarding the contract for that capacity building center. So we expect to have that contract awarded by August. So this next slide is focused on the Michigan Intensive Child and Adolescent Services, as I mentioned before, the MICUS array. So the 6 services that we are really working to expand across the state are the Intensive Crisis Stabilization, or ICSS, home-based services, respite, shifting from wraparound to intensive care coordination with wraparound, youth peer supports, and parent support partners. So those are kind of the 6 that we have focused on right now on expanding throughout the state. The next couple slides are going to dive a little bit into the Michicans. If you are not familiar with the Michicans, this is our standardized assessment tool. So working on kind of a standardized process to assess children across the state for service eligibility. Michicans is really kind of a shift in that we'll no longer be using the CAPAS and PECFIS scores to determine eligibility for services. So there's not a direct score correlation there, but it's really more about gathering a family story and integrating that story into a comprehensive list of strengths and needs for that family. So really determining based on the information gathered what a child or a family may be eligible for. Dives a little bit into the nuts and bolts of who's required, who the Michicans is for and who's required. So the Michigan screener is required at the point of access for all young adults through the age of 21. So information is gathered on that screener, like I said, to determine eligibility for potential services. At the time of intake, the Michigan's comprehensive, which is kind of a more robust tool than the initial screener, will be used for all infants, toddlers, young children, youth, and young adults up to age 20. We are still continuing to use the Devereaux Early Childhood Assessment, or the DECA, with infants, toddlers, birth to age 6 with SED or SED-IDD. The Michigan's is updated on an annual basis. It can also be updated if there's a significant change in life circumstances. So if there's a placement change or a traumatic event that happens in the child's life, that would be a good time for that Michigan's to be updated to determine if there's new needs for services identified. This slide is a little bit of similar information from the last slide, but we do have ongoing conversations to support cross-systems understanding of the Michigan's and cross-systems use of the Michigan. So some of the entities that we're working with are the CCBHCs, Children's Services Administration, State Hospital Administration, and then our psychiatric residential treatment facilities. This gives you a kind of a brief look at the screener. So as I mentioned before, the screener is used at Access as a standard way to guide initial assessment and eligibility. So these are the 4 domains that are initially assessed with the Michigan screener. So we have life functioning, behavioral and emotional needs, risk factors, and then family cultural. This is the Michigan's comprehensive. So as you can see, we have the domains. Oh, I'm sorry. Skipping ahead on slides here. The domains here, and then we have modules and submodules. So the comprehensive really takes a much deeper dive into some of the needs. So if there is needs that are identified in the domains category, and then as you can see, they're detailed out further in the modules, and then these are the submodules here. If you need more information about the Michigans or like to kind of take a deeper dive into information about the Michigans, there's a variety of resources you can tap into. We have the Parade Foundation here. We do have a Michigans website available through our MDHHS website. And then we also have a mailbox. So if you're looking around or have specific questions about the Michigans, you can contact that mailbox and we'll get back to you there. This provides just a very high-level timeline of our Michigan's implementation. So as you can see, we have completed our soft launch phase, which was completed with community mental health service providers across the state. Just a handful there to kind of get some lessons learned before we're working towards full implementation across the state, which will begin on October 1st. I want to take just a quick minute to talk about some of the workforce development and training initiatives that we have going on. I mentioned these a little bit earlier. We currently have a student loan repayment program, which is, we had $4.4 million awarded in fiscal year 23, and then we have another $3 million scheduled for delivery this year. We have an internship stipend program that will be starting, and that is $3.5 million to support internships to, again, expand the behavioral health workforce. And then I already talked a little bit about our capacity building center, which will be kicking off in October. So I'm going to turn it back over to Patty. I don't know if there are, I can't see the chat, so I don't know if there are specific questions, but Patty, I'll kick it back over to you to close out.
Thank you, Allie. So you can see we've got our contact information here. If folks are looking for any of us and you have additional questions, concerns, anything like that, you can always feel free to reach out. I do think that there may be one additional question that I see so far that we haven't answered yet. Is that right, folks?
Yeah, that's correct. We've had a question about how do people find out about these services that are out there for their child? The last presenter mentioned access centers, but what does that actually mean? Where do folks go to access these services?
Certainly. Great question. We do and can provide information. I think Ally, if maybe you can plop it into the chat for folks. For our BCHIP's website, there's lots of information there related as well to listings for individual counties, community mental health agencies, and information for Michigans, as well as for some of the services as well that are available through the local level at the community mental health. But Ally, would you be able to put that in the chat?
Yep, I'm grabbing it right now.
And if there are ever specific questions, you can also reach out to one of us and we can provide answers to those as well around services. Are there additional questions?
We had one question remaining from earlier about who can make referrals to any of these
Mhm.
agencies. Can it be parents? And who else?
Definitely. Do you make referrals? Say that one more time. I'm sorry. Make referrals for
To access these programs.
so as it relates to programs and services for children, youth, and families that through their CMH, most definitely parents can do that. I think I may have also seen a question about parents making referrals for some clinical support on service navigation, and definitely parents can make referrals to that for that as well and make requests. And we provided the mailbox for the Office of the Advocate for Community, for Children, Youth, and Families for that as well.
Okay, thank you. And the link is available in the chat where you can follow up and see what's actually in your area and who your contact person is and the services that are available. So thank you so much for joining us today.
Thank you for having us.
This is the first hour of our disability policy webinar series.